Today, I want to answer a question that I've gotten a few times from people recently, and that is, what disruptive things are happening in the healthcare system right now? And also, caveat with, but realistic. Like, what is a disruptive, innovative thing happening that's also realistic to be able to implement right away? And so the one topic to focus on today is a platform called BowTie. And the reason that I bring them up specifically is that they've taken one piece of healthcare further than anyone that we've seen so far, and that is cash prices. Have you ever asked to negotiate a healthcare bill? I know that if I have a one-off emergency room bill, I often will call the billing team and say, hey, I can't afford to pay this $1,500 bill. Can we talk about some type of discount if I were to pay in full or a monthly payment plan? That's usually a good option, especially if it's a one-off. But BowTie is thinking, how do we apply this concept to everything? And while we're doing it, how do we steer people to good care at good prices? Pretty simple, right? So imagine we have these data warehouses with all kinds of data, thanks to a couple of legislation pieces that have passed, such as the CAA, the Consolidated Appropriations Act of 2021. But the bottom line for the everyday person is we have pricing data as to what hospitals and healthcare systems will accept if someone doesn't have insurance. And we have quality data. How many complications do we have, for example? So we can steer people who are not tied to any certain doctor or healthcare system, or maybe if they just knew they could go somewhere for a good price and good quality, they'd go there anyway. So this concept, broken down at the most simple level, is, hey, if you need medical care of any kind, whether it's visiting a primary care physician to find a family doctor, or whether it's for a dermatology appointment, or whether it's something really big like a knee surgery, if you call us, tell us where you want to go, we'll review it and let you know the cost of it. And if we can negotiate a cash price with that provider, the healthcare is free. If that person you want to go to isn't willing to work with us and accept cash, or maybe they're just really bad quality and you don't know it, then we'll make recommendations to where you can go. And again, it's free to you as the member, the user of healthcare. How do we make it free? There's so much waste. There's so much waste in the medical system in general that we can just cut out the fat. When we cut out the fat, we can reinvest that back into our employees and then give it to them for free. And the employer ends up paying the same amount or maybe even less on the back end. How about that? It's worth considering.